Greetings and welcome to Healthcare Leadership Live. This is the podcast for clinical healthcare leaders who want to level up their leadership or the way that they operate their business because healthcare is a business here. And we have a person here on the show who is going to help us learn about the business of healthcare and how we collect money, that all important revenue. My guest here is Alethea Bryant. Welcome to the show.
Good morning. Good morning. Thank you, Mike. And thank you for having me on this show.
Yeah, I'm so glad to have you. I love the billing people in a healthcare business because we can't do our jobs in HR or marketing, or no one has a job if we don't collect money. So thank you for what you do, first of all.
Oh, thank you. Thank you. And I'm
And
glad you recognize that.
I do because in HR we have to kind of tip our hat to everyone because HR doesn't make money. It's the providers, the medical assistants, the billing staff, the front desk that collects the insurance. All those people are so important, and so we're just there to help make sure that things keep working. But I guess before we get too far down the road here, Alethea, tell me about, or tell my listeners here about the work that you do, and I'd be really interested to hear why do you do that, and maybe a little bit of how you got into it.
Absolutely. Absolutely. So I actually own a national medical billing, coding, and credentialing company. So basically, we handle everything that pertains to working with insurance as far as providers are concerned in private practice. So we help them get contracted with the payers, handle the billing for them if they need to, communicate with patients because, as we all know, patients may not always understand what their benefit coverage is and what that looks like when they're going to go get treated by the provider. And then all the way into going to training and consultations. So sometimes we come across some providers that feel pretty comfortable and have a pretty good basic knowledge and understanding of working with insurance payers, but they need some help.
Mm.
So we have systems in place to actually help them too if they just need to kind of figure out, what am I doing wrong? Why won't these claims get paid? We're definitely that go-to for everything related to insurance. And how did I get started in this? Kind of an interesting story. Before I started Real Unique Enterprises, I worked in banking or actual financial industry for about 17 years, 14 of that at a private owned bank. However, while working at the bank, I also had to deal with life work balancing challenges because I had a son who had major health conditions, epilepsy being number one. And as time went on, I was really struggling with being able to do all of my jobs, overseeing 5 departments, helping out with multiple branches. I was having a hard time being able to keep up with that, with what was going on with my son, doctor's appointments, specialists, always having to run from work. So ultimately, I had to make that very hard decision as to whether I wanted to just take time off or step out on a leap of faith. And that was the option I chose. I had somebody mention to me, well, have you ever thought about medical billing? You kind of work extensively with insurance dealing with your child.
Mhm.
He was diagnosed at the age of 1 and he's now 30 or be 30 coming up this year. So that did kind of give me that door opening. Hadn't thought about it, considered it, looked into it, fell in love with it.
Mm.
Able to use all my tools and resources and all the knowledge that I gained in the financial industry and bring that over to the healthcare side. That coupled with, being the parent of a patient who
Mm.
work extensively with insurance payers for a variety of reasons, but now integrating that into a model that helps providers who often do not understand how important it is to learn how to do billing, what all the acronyms are, and just how you navigate the labyrinth that all of us have to deal with if you're dealing with any aspect of healthcare.
Well, yeah, I would think from your background, you have a particular insight, right? From helping your son. And I imagine that there were a lot of, providers and
Mhm.
medical assistants and practices that you had to interact with. And some maybe were better than others in
Mhm.
terms of, how their service delivery, but also their billing and all of
Yes.
that. And, I think do you have a particular focus of what types of providers that you like to work with?
Yes. Yes. So we focus primarily on mental health providers and all the therapies: massage therapy, acupuncturist, chiropractic, occupational therapy, speech therapy. And again, dealing with my son, a
Yeah.
lot of these helped tremendously as
Mm,
we went through our path of trying to get him to a point where he was stabilized.
mm,
So that created a strong belief system for me that no, all of these are in aggregate to the overall whole health of the person, especially when you're dealing with multiple health challenges. It's
mm,
important to have
yeah.
all of them.
Now you said that you take, I think you said you take phone calls or you deal with contacts from patients. So if a practice, wants to offload that, which I could see that being a real useful service, I would, you probably have a unique perspective when dealing with those calls because you've kind of been in that patient seat or that mom seat, right?
Mhm.
Do you have any special tips for dealing with upset or frustrated patients who are frustrated with their billing information? I couldn't
Yeah.
resist asking that because you are good at that.
Yes, the old golden rule that don't take it personal.
Mm,
Do not take it personal. If you have a patient in your office that is just like bent out of shape, upset, just in tears in some cases, don't take it personal. Take a deep breath, take a step back, and realize, see if you can kind of picture yourself in their shoes. They're probably dealing with, in many cases, a multitude of different things. Their health is having
mm,
challenges, which is affecting their capability to maybe do work or even do simple tasks at home. So, understanding that, yes, it can be challenging to deal with a patient in that condition. But if you take a step back, don't take it personal, show as much compassion as empathy as you can, you'd be surprised
mm.
as to how quickly that can turn around. And now they're just kind of crying out to you for help.
I have found as a patient that just having someone who is willing to take the time and explain things. The worst thing is when you all you have is an email address or some toll-free number and you can't get an answer. So just to be able to have a person that you can say, "Hey, can you explain this to me?" And even if maybe the news isn't so great or whatever, at least they're explaining it to me and they can, go through all that. And
Yes, yes.
imagine that you kind of can help with that.
Absolutely, absolutely. One of the aspects of running a successful practice, if you are going to be working with insurance, is to actually understand insurance,
Mm,
know the different plan types, the fundamental of the different plan types, have a basic understanding of how they operate. Because, yeah, being able to kind of communicate clearly to the patient of what's going on, that, you know, I'm sorry, but yeah, you do have a balance of $250 because you have a deductible. They may not even understand what that means. And in a time of high stress for the patient, maybe because they do have all these doctor's appointments they're going through, and they're very nervous about the results of some tests that were recently done. They may not truly understand that, yeah, they do have some out of pocket expense and what that looks like and how you can help them kind of navigate that system a little bit, if you will. And always keep in mind that most payers have a patient advocate team.
Mm.
Use it.
Mm.
Use it.
Use that team for sure. Yeah.
Yes.
They want to keep that relationship going. So I can see why they would have that.
Yes.
This show is sponsored by Seasoned Advice HR Services, where I help clinical healthcare businesses to make more money and save more money by hiring better, retaining better, and reducing your HR risk. If you would like an HR assessment or ongoing HR support, please reach out to me at seasoned-advice.com. You talked about helping providers, right? And I think that's really what this show is all about, and that's why I do what I do, and I imagine that's what helps to drive you. And so, if someone's listening to this show and they're thinking, gosh, I would like to have better collections and get more of my claims paid, what is something that you commonly see with the clients that you work with that they're not doing, or that if they just did it differently, that they could immediately see an improvement in their bottom line?
One of the things that I see often is not having a simple system in place with how you're going to deal with that patient once they come in the door. So they come to you for treatment. What do you do next? Well, you want to find out how, of course, they're going to pay you for that treatment, whether it's going to be cash out of pocket, or they're going to use insurance benefits, or are they going to use something like an FSA, flexible spending account card, a health savings account card? Finding out how they are going to cover the payment for that treatment. And if they're going to use insurance, then you need to verify the benefit coverage. I think that's one of the biggest downfalls for a lot of practices, is wanting to kind of skip that step, not thinking about how vitally important it is for you to know as the practice what their benefit coverage is. Are you in or out of network for their plan? Do not assume that just because you went through the process of becoming contracted with Aetna, that makes you in network with all of their plan types. Insurance payers could have hundreds, believe it or not, plan types with small variations from one to the other. But when a provider is becoming contracted, you don't always notice that, oh my, I didn't sign up for Medicare Advantage if I was eligible, or oh my, I don't have EPO as one of the plan types that I can treat. So if you don't do that benefits verification, you don't find out something that could be a surprise, is something as simple as, oh, I'm not in network for that plan type, or finding out that maybe they do have a deductible and they have a high deductible. That's going to mean that a lot of the coverage is going to be out of pocket for that patient for a while. So once you know the benefit details, you can sit down and have an honest conversation with that patient. You want to make sure that they are making an informed decision about treatment with you. You don't want them surprised. You all hear of all of the hoopla in the news with surprise medical bills. Well, one way to stop that in the tracks in the beginning is to verify the benefit coverage. Find out if there is coverage, how much is going to cost the patient, and how much is going to cost the practice as well.
No one likes surprises. It's really, surprise birthday party, maybe, but surprise bill, surprise costs. I don't like it. I don't think you like it, if Letha. I don't think our patients like it. And
Right.
so that's a great tip. Another thing that I have heard providers talking about more and more in the social media space is really just the maybe the surprise that they get from insurance companies that something's denied or that they have to jump through additional hoops. Have you seen an increase in the hoops or the red tape that providers have to go through to get claims paid, or is it kind of just as annoying as ever?
No, I have not seen any increase.
Okay, that's good.
Um, and often, what I find is a certain percentage of those providers that are like, "Oh my God, I can't get these paid. What's going on?" They haven't taken the time to understand how to work with insurance or how to do the billing correctly. You can send in the claims. You can send them in using software, electronic billing, or you can send them in by paper, mailing the CMS 1500 form to the payer for processing. But either way, if you've not done the due diligence before you've actually even sent that claim to them, then you're just waiting for a surprise. You
Mm,
don't know what's actually going to happen with that claim if you just send it in blindly. If you've not done the benefits verification, and when you do the benefits verification, it's going to uncover things like authorization is needed.
mm,
There's a limit on the number of sessions. It's going to uncover, there's an exclusion on the plan that it won't cover that specific diagnosis.
mm,
All of that information is uncovered during that benefits verification period. So if you did that piece, then when the claim goes in, you should be sitting at least 85% confidence that that claim's just going to get paid once it gets there.
mm,
But if you've not done that work to find out, am I in network? Are there any exclusions? Are there any requirements for authorization? Do
mm,
I have to get an authorization? What does that look like? Do I got to send in medical notes for that authorization? All of that needs to transpire before treatment starts and before any claims go in. The ones that I see that struggle the most, they've opened up the practice, they've gotten the NPI, they're good to go, they got the software, and they just send the claims. They treat the patients, they get the patients in the door, and they just send the claims in. And now all of a sudden they start denying or rejecting, and they have no idea why. But they're kind of caught up in the day to day treating the patients, and now they don't have time to sit down and look at those claims as well to figure out what is going on. Why are all these claims denying? It could be something simple. You forgot to put your NPI number on the claim.
mm,
Learning how the fundamentals of learning how to do billing could help too, because it might be all the benefits are all right, but you didn't fill out the claim correctly.
mm,
So when it got to the insurance payer, they just kick it out and deny it. Um,
mm,
it is, as far as the insurance payers are concerned, it is the obligation and responsibility for the provider to basically learn how to bill.
mm,
And if you're not going to learn how to bill, and I wouldn't expect providers to, your specialty is treating the patient. But if you're not going to take the time to really learn that, get the help.
mm.
Get the help.
Yeah.
Don't struggle. Don't lose all that money because you don't know how to do it, or you don't feel you have the adequate time to follow up on the claims
Mm.
to figure out how to fix it.
And that's time consuming. And for someone, especially in the niche that you serve, I'm curious, do you work with a lot of sort of single provider businesses where it's
Yes.
like one gal or guy
Yep.
and their time is valuable,
Yes.
They need
Yes.
they need to see patients, right?
Correct. Correct. That the most important part of what they do is to see patients, to get paid, to
Yeah.
get the doors open. Um, and solo providers, I think, get hit the hardest because they often may not recognize that they are doing it all.
Hmm.
They're seeing the patients, but they're doing the marketing,
Yeah.
they're doing billing, they're trying to kind of handle all that and not recognizing all that going into the practice, the setup of the practice could also create some issues for them. Not recognizing that they had all these duties to
Mm.
take care of. And so that's why it's important to reach out for help. Don't try to bumble your way through it and figure it out, especially when you're short on time.
Mm.
You really need to reach out to somebody to help for billing, reach out to somebody to help on HR, reach out to somebody to help on your tech, your
Mm.
IT stuff. All of that is important for your practice.
It's amazing how many providers out there, they hold on to that stuff. I
Yeah.
talked to one the other day, and he was in a multiple doctor practice, I think 3 or 4 MDs, and he was like, I don't need that stuff. I've got one person who supervises the team, I do the finance, someone else does the this and that. And I'm thinking, man, you're holding yourself back because you could have help. Your time is more valuable, right?
Yep. Yes.
I'm curious, so you talked about billing. I would think with a lot of the providers that you deal with, therapists, there's a lot of cash based payers, right? And
Hmm.
so, does that pose like a different challenge when you have cash pay and insurance pay? And I don't know, tell me
Great
about the things.
question, Mike. Great
Yeah.
question. Um, there is no difference. Interestingly enough, I recently, I'm working with a client right now, that I think that is what he's really struggling with is, um, he's debating, do I even want to work with insurance? I think
Mm,
it'll be so much easier
okay.
if I just work with cash. And yes and no. And here's why. Because even though you're working with cash paying patients slash clients, depending on, there's a difference on what you can call them.
Yeah.
But depending, if you're working with them and it's just cash, you still have forms that legally you are required to have. You still have to do HIPAA notifications. You still have to do informed consent notifications. You still have to do privacy notice notifications. You still have to collect data on them and maintain those medical records, and that has absolutely nothing to do with insurance. That has
Mm,
to do with your licensing type. So I think a lot of practices are under that misconception
mm,
that it's way easier if I don't work with insurance. Well, depending on what your goals are for your practice. If your goals are to really grow and increase revenues, no, it's not going to be as simplistic as
mm,
it seems, because you still have paperwork that you have to provide to them per federal and or state laws. And not abiding by those is what could definitely get your practice in hot water
mm.
and potentially have your license suspended.
Well, that sounds like something to pay attention to there.
Yes, yes.
um, with those therapists and massage therapists, acupuncturists, maybe speech, occupational therapy. I work a lot in the world of ophthalmology,
Mhm.
which is very different. But from a billing perspective, what are some differences, if any, that you see between the kinds of clients that you work with and the struggles that, an ophthalmologist or a cardiologist or a dermatologist might experience?
Some of the differences, well, one thing's for sure is, dealing with massage therapists and acupuncturists in particular. There is a small number of procedure codes that the insurance payers will actually reimburse.
Mm.
And that could be a good thing or maybe not so good thing. It just kind of depends on, how you look at it and what your overall practice model is. The billing itself is fundamentally the same.
Mm.
Where there becomes kind of some differences is the coding. So the procedure codes that are going to be used for billing. And yeah, acupuncture massage therapists have like less than 10 codes
Mm.
that they can bill, that the insurance payers will cover. Chiropractic, that code list maybe goes up by 5 or so. Still kind of a short list. But when you jump over to like optometrist, oh my gosh, that list is like 50, if
Mm.
not more.
Yeah.
So, really understanding what the codes are, what modifiers are, all those little
Mm.
details, and certain provider types has a far greater list that they have to deal with when it comes to coding and understanding the modifiers and stuff that go with it. Even mental health, depending on, are you just a how can I put it? More traditional, I guess, mental health provider,
Mm.
just straightforward.
Yeah.
Or are you a mental health provider that deals with substance abuse? Are
Mm.
you a mental health provider that does intensive outpatient therapy? So when you start getting into those different categories, again, your coding is going to expand. And the information that you need to know in order to bill it accurately definitely becomes far more expensive.
Okay. Interesting. Um, well, Aletha, your expertise is certainly valuable, and I think you've demonstrated that here. If someone wants to get in touch with you to explore how you could help their clinical business, how can they get in touch with you?
They could visit us on the website, which is www.real, R-I-L-L, uniqueenterprises.com. They can send an email, customerservce@realuniqueenterprises.com, or you can pretty much find us on all social media, LinkedIn, Facebook, Twitter. We're out there on all the platforms.
All
So
right.
just drop us a note or set up a free consultation and let's have a chat. Let's see
Okay.
what's going on.
Well, I've enjoyed this chat. You are clearly an expert in what you do and great at communicating about it. I will drop those links into the show notes for this show. So if you're listening to this, check the show notes. They will be there. But it's been a real pleasure, Aletha. Thanks for being on the show with me.
Thank you, Mike, and thank you for inviting me.
Well, that brings this episode of Healthcare Leadership Live to a conclusion. If you enjoyed this episode, please subscribe to the show on your podcast app and share it with someone who would value the content. I promise to bring you more guests and content to help make you a better healthcare clinical leader. I also invite you to subscribe to my HR newsletter for healthcare leaders. You can find information about that at seasoned-advice.com. Now go out there and lead with confidence.